You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J Tassoni Jr., with today's guest.
Welcome to Recovery TV, and I'm your host, John Tassoni. My guest today is Jamie Lehane, and Jamie is the President and CEO of Newport County Mental Health. Welcome, Jamie, and thank you for joining us today.
Well, thank you, John. Thanks for having me.
So tell my viewers what Newport Mental Health does and does not do.
Well, Newport Mental Health is the community mental health center designated in statute in Rhode Island to provide mental health and substance use outpatient treatment to any of the 82,000 citizens of Newport County. We serve from cradle to grave, from early childhood to older adults, and we specialize in providing research-based intensive recovery treatment that's person-centered and tailored to the reason someone walks in our door to see us.
Newport County, big group of individuals that visit Newport County Mental Health?
Well, we serve at any one time over 1,400, almost 1,500 individuals. Since before COVID hit, before March 20, the demand for mental health and substance use treatment has been nothing but going up. But as we hit the pandemic, as everybody knows, this has taken a real toll on people's emotional well-being. The number of people walking in our door, because we're now a certified behavioral health clinic, which means we see you today. We have a crisis line 24 hours, and if you need help, you can walk in our door Monday through Friday during business hours and get a professional assessment. We've seen, particularly kids and adolescents, 30% increase during the pandemic.
So let me ask you a couple of things about Kodiak Island, because obviously I'm from Northern Rhode Island. I don't get down to Kodiak Island that much. But your organization, how long has it been in existence?
We just had our 57th annual meeting of our board of directors. We were the first community mental health center, as you may know, that community mental health centers were set up all over the country. In 1963, the Community Mental Health Center Act, the Kennedys, and of course, the Kennedys like Newport, and so that's not why. But we were funded, and federal dollars, and again, we're seeing that Congress and the federal government saw the need, the tremendous need for mental health treatment and substance use treatment. And these centers were all federally funded for the first several decades. And then the Reagan administration cut those dollars, and states picked up that social responsibility. But I have to say today, there's not $1 you can find in the Rhode Island state budget that supports these much needed therapy and services. And that's why Rhode Island has the highest number of people that are in hospitals. And we spend more dollars per person in Rhode Island, both through insurance and Medicaid, than any other New England state, John. But the money all waits until somebody's suicidal, they overdose, and they're all in the wrong end of the system. So we are trying to be there for people as soon as they have a sign and symptom that they need help. And the earlier in their life we can get you, recovery works in treatment.
So let me ask you another question, Jamie. Since the rise of people needing mental health and substance use treatment, have you seen a rise in uncompensated care on your end? I know the rates are the rates, and we're working hard to get those rates changed. But there is got to be a huge number for you on the uncompensated
We
care.
actually track that.
Okay.
Both the licensing requirements in the state of Rhode Island and our new higher level certified behavioral health clinic national standards, we treat everybody regardless of whether they're insured, they're not insured. Most people, what people don't realize, when it comes to a serious mental illness or substance use treatment, they're underinsured. because we know the standard of care and the kind of intensive treatments that do get people better, do get them in recovery, get them healthy and happy again, are not the one session with a doctor a month or 90 days and a therapist. We basically are working with people to get them jobs, get them stable, decent, affordable housing. You have to treat their lives, not just the symptoms of their mental illness. And so we gave last year $1.25 million of free care, uncompensated care. John, as you know more than anybody, 2 years ago, many of the nonprofit, that we call them safety net, mental health and substance providers, were virtually about to close their doors and go bankrupt. Newport Mental Health was one of those. Mm-hmm. We turned to Congress. You had Sheldon Whitehouse on in one of your recent shows, and he really spoke about the CARES Act. Well, Congress has been appropriating through their Substance Use Mental Health Service Administration Department millions and millions of dollars to address. We have a suicide epidemic, not just an oversight.
Right.
And people rarely talk about that. Rhode Island, they track deaths, but because we're a small state, we got great rescues and EMTs. It isn't deaths from suicide and overdose, it's attempts, and they're through the roof. They're higher than any of the regional states. So we give out a lot of free care because the kind of approaches we need are more team-based, and insurances don't pay for it.
Well, the other thing too that it really boggles my mind is that hospitals get a payment to the state budget on uncompensated care.
Used to be called disproportionate share payments. Right.
And we should be entitled to that. Your organization should be entitled to that because it's not going to get any better tomorrow. Right. It's not going to get any better next year.
John, let's talk rates.
Yeah.
Rhode Island, the council here, the leadership council, some of its members, Linda Hurley at Kodiak, sat on a Senate rate commission, and we found out our insurance rates in Rhode Island are 25 to 30% below Massachusetts, Connecticut, and many of the other New England states. And that's an understatement because all of our sister New England states provide state dollars because some things insurances don't cover. The getting people back to work service, that's not an insurance coverage. So we're really underfunded, and it puts this system of care under a lot of stress.
Well, we're taping now, but there is a couple of bills to help us out with rates with Senator DePalma and Representative Casimiro. So they're up for hearing shortly. So hopefully they can get that rate.
We need our listening audience to support several of the state bills that are in. The rate bill that Senator DePalma and Casimiro is a fantastic opportunity to fix this.
All right, we're going to take a quick break. You're watching Recovery TV, and I'm your host, John Tassoni. I'm here today with Jamie Lehane, the CEO and President of Newport County Mental Health. We'll be right back after this.
My first experience with addiction was actually with a family member. I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You can make it through this, you can get back on track.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodiak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodiak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodiak
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
The Rhode Island Department of Health reports that drug overdose death is the #1 cause of accidental death in our state. Zinnia Exeter is committed to helping overcome addiction and the silent epidemic of drug overdose. Our substance abuse completion rates are over 25% higher than the national average. If you or a loved one is struggling with addiction, call Zinnia Exeter to learn about treatment options.
And now back to Recovery TV with your host, John J Tassoni Jr. Recovery TV made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. My guest today is Mr. Jamie Lehane, and Jamie is the President and CEO of Newport County Mental Health. Jamie, thank you for joining us today.
Thanks, Sean.
I want to talk a little bit about the new initiative that's been rolling from the feds down here to Rhode Island, the CCBHCs. I know you're one of them, one of 5,
Yes.
I believe, in Rhode Island, and we're
Exactly.
looking to get more. So explain a little bit about the CCBHCs.
Sure. CCBHC is really has been a pilot demonstration program that Congress, recognizing the tremendous emotional needs of our kids and our adults and substance use needs. So CCBHC is a federal program where it increases Medicaid funding so that we could provide a higher level of care. And it actually has one little catch. For states to adopt this program, they have to pay the providers what it costs to provide the best evidence-based treatment.
Right.
So we brought in, Newport Mental Health was the first CCBHC in Rhode Island because it was so successful. They only had money to start with 8 states, and then the outcomes were transformational. And they then added a couple states, and then they said, this is like a vaccine. When you're in the pilot state, look at it, it's working, let's get it out. So now they gave grants out. So we are on our 3rd $4 million grant, and we've helped. It also allows you to subcontract to other partners. So we brought in, between the 2 federal programs, the CCBHC grant programs and the Community Mental Health Center program, together with our partners, the 5 CCBA, we brought about $30 million of new money into the state of Rhode Island. But to sustain this,
Right.
there's a bill called the Mental Health Excellence Act. Senator Rhode is actually stepping up to be one of the sponsors. It is a bipartisan bill. Actually, a Republican in Missouri, Senator Blunt, is the lead on this, and it's going to offer this program to Rhode Island, I think, over the next year. And we have to hope that our executive branch and legislative leaders adopt it, because it will sustain the kind of services that get people better.
Yeah, and you bring up a good point too. $30 million.
lot of money.
Every dollar that's brought into a round goes around 7 times. That's a lot of money.
Right.
30 million times 7.
Right.
A lot of money.
And we expect that if this bill's passed, there will be at least $30 million of new federal dollars year after year.
Right.
So we can turn this boat around.
That's the key.
And get people from, before they end up being suicidal and homicidal and in hospitals, and get them the help that they need.
Right.
That could be very effective.
Workforce.
Oh, gosh. All of
where
healthcare is
are
in
we
a
with
crisis.
workforce?
Newport Mental Health, we've doubled in size since the past 2 years with this federal money, from like 80. We've got over 200 positions now, 42 vacancies today.
42.
Right, because the rates, when you're paid 30% less, we're on the Kodiak Island, 10 minutes over the bridge, you're in Fall River, and you can make 30% more in our field, being a mental health counselor or a case manager or a psychiatrist. Mm-hmm. The rates in our sister states allow them to pay more.
What about retention?
Retention is the key, because recruiting is one thing, but when you're paying somebody, that has a bachelor's degree coming into this field as a case manager, $16 an hour. They can be an entry level supervisor at McDonald's, a shift supervisor, and make 18. We struggle. So we are doing things like retention bonuses. We're paying for people's tuition. We give a $2,500 tuition credit if you want to go back to school, because we're trying to build a workforce in mental health.
Yeah.
And we do tuition reimbursement if you have student loans.
What are your employees saying about this? I mean, obviously, you're a type of guy that you're on the floor, per se.
Right.
You go and you talk to people.
Right.
What are they saying?
Well,
Are they getting frustrated with the system as a whole?
Because we've been more successful only because of Congress and the federal dollars, we've been trying to turn that. As soon as we are able to build a little bit of money, we are turning it over to salaries. So I think they're a little hopeful, because workforce and quality is our number one goal, because without good employees, we can't provide quality services. But people get into this because of their passion and mission to help people, but it only goes so far, John.
Yeah.
So we struggle with turnover, like everybody.
I as you know, I lobby up at the State House, and this is what I hear. Your guys, your CEOs, meaning you, are making way too much money. Way too much money, and that's all you're asking for is money for the CEOs.
Yeah, right.
I want you to address that.
I'll address that. I'm going to tell you a little bit about my background. I have a master's in hospital administration from the Yale Business School and the Yale School of Public Health. I graduated with 9 other folks. They're all running university. Actually, they're retired on yachts and islands. I live in Portsmouth in a little 3-bedroom house. We're not being paid anywhere near where healthcare professionals are. I'm happy with my salary. Every dollar we're bringing in, we need to increase these salaries for our staff.
Yeah.
So I think that's hogwash.
And that's the key. That's the key. I mean, you see hospitals with 2,000 vacancies. You see a place like yours, 42 vacancies. Something is not meshing here. Whether it's the hospitals, whether it's
we save lives.
Right. Exactly.
People go off our bridges. You don't even know the countless number of people who we prevent from these kind of adverse efforts. We have one other need, John. Now that we've been a little bit more successful with this federal dollars, we have doubled our staffing, but we haven't doubled our space. So we do have a bill in, because the Rhode Island Foundation and others know that COVID impacted people's well-being. And one of the bills, because it's one-time money, this new Rescue Act, they got $1 billion. We need some of that to improve actually state properties we work in that are falling apart and been uncared for.
Yeah.
And also we need to expand our facilities. So we do have a capital bill.
Yeah, I want to talk about that when we come back from break.
Thank you.
You're watching Recovery TV, and I'm your host, John Tassoni. My guest today, Mr. Jamie Lehane, who's the president and CEO of Newport County Mental Health. And we'll be right back after this.
Every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
Addiction Recovery Institute, with locations in Pawtucket and Warwick, have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
With these,
and this,
with my mouth shut,
and my ears wide open,
it means that from the moment you walk into the room,
you're the most important patient to me.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
And now back to Recovery TV with your host, John J Tassoni Jr. Recovery TV made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. My guest today is Mr. Jamie Lehane, and Jamie is the president and CEO of Newport Mental Health. Jamie, thank you for joining us today, and thank you for the work that you're doing at Kodiak Island. But one of the things I wanted to talk to you about from the last segment is this infrastructure bill that you have in the General Assembly with the ARPA money that's sitting in the bank that we need because you have state properties that are in shambles, and we needed to get it back up and running to be respectful office space and treatment facilities. Talk a little bit about that.
Sure. Some of the facilities that we provide our community-based mental health and substance use care throughout the state have actually, back in the 80s when they were expanding the system and helping people stay out of hospitals, they provided state-owned buildings for us. And, you know, we pay $1 a year. You think, what a great deal, free space. But the leases, because, you know, we get paid so little in terms of insurance rates, we don't have reserves. We don't have the capital to keep these buildings up. Across the state, these buildings are dilapidated and not a place that you would respectfully want to serve your patients. Community Care Alliance in Woonsocket has a building they had to walk away from. The roof was leaking, filled with black mold. So what we're asking is that a small amount of that $1 billion be put to the infrastructure for these critical mental health facilities and substance use treatment facilities. So we do have a bill. Senator DePalma again championing in the Senate, and I think it's Senator Bajolski in the House. Yeah. So we're looking to get a little bit of money. I've doubled my staff. If we're out of space, we're hoteling therapy rooms. Yeah. So we do need some support around our facilities.
Well, I want to wish you and the rest of your organization the best of luck. Hopefully we can get across the finish line this year with some meaningful legislation and financing too, because it's very much needed.
Yeah, I think this is a legislation, a new speaker leadership that's very supportive of the work we're doing.
So I want to thank you again.
Thanks, Joe.
You've been watching Recovery TV, and I'm your host, John Tassoni. Jamie Lehane has been my guest, the CEO and president of Newport County Mental Health, and we'll see you next week.
You know, every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
Anchor Recovery has been a mainstay since 2010 and was the first recovery community center in the state. Anchor Recovery has grown from just a couple of 12-step meetings to an entire cadre of meetings supporting multiple pathways of recovery. Today, we support medicated assisted treatment, mindfulness, meditation, yoga, and physical aspects of recovery. Easy access in 3 locations. Learn about how recovery can help you. Different paths, same destination. Stop in, call, or visit anchorrecovery.providencecenter.org.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
Sometimes everyone can use a helping hand. At TriCounty Community Action Agency, we offer support services when you need it the most. From food and heating assistance to family health and dental care, we have programs to lend a helping hand throughout the whole life cycle. From grandkids to grandmas, individuals or families. If you or someone you know could use a helping hand, visit our website at tricountry.org to learn more about the many services we provide. We know it isn't easy to ask for help. At TriCounty, we are here when you need us. For more information, visit tricountry.org or call 401-351-2750.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
With these,
And this.
with my mouth shut,
And my ears wide open.
it means that from the moment you walk into the room,
You're the most important patient to me.
When it comes to home improvement, a courtroom is the last place where you want to end up dealing with a contractor. We have all heard the nightmare stories. Avoid any legal hassles and reach out to a contractor you can trust. Lapco Contracting. Interior or exterior painting, small or large repairs, or a home renovation. You'll always get the right verdict with Lapco Contracting. Call Lapco now at 1-800-PAINTING or log on to LOP as in professional, cocontracting.com today. Salute. Adjourned.
Tune in every weekend for a new edition of Recovery TV. Host John J Tassoni Jr. discusses information on addiction and mental health issues with local leaders in today's recovery world. Tune in Saturday evenings on MyRI TV or Sunday mornings on CW Providence or Fox Providence.